All right, so for the sportsman presentation, I decided to do the quadriceps strain. All right, so for the anatomical review, the quad muscles, we kind of did this in class, brief review. So the quadricep muscle has the quadricep has four different muscles. This includes the rectus femoris, the vastus lateralis, the vastus medialis, and the vastus intermedius. So the commonalities between all four is the action and the innervation, or where the nerves meet. The nerve endings are. So for the action, they all extend the knee, every single one, and the innervation. This is they all are at the muscular branches of the femoral nerve. So the rectus femoris, the origin for this is it's on the inferior iliac spine, and the insertion of this it's on the base of the patella, and it's the more central portion. So if you flex your leg, you'd be able to see a central muscle going down. That's the rectus femoris. You need to be careful not to not confuse it with the intermedius, because they're both in the middle. So the origin of the vastus lateralis, this is on the lateral portion of the gluteal tuberosity of the femur, and as well as the insertion of this is on the lateral side. For the medialis, same thing. It's the insertion. It's on the medial side of the leg, given the name, and it's on the medial side, so the inner side. Yeah, sorry. Okay, and for the vastus intermedius, this is it borders the patella. It's more towards the lateral side. Again, it's hard to differentiate between the rectus femoris and the intermedius because they're so similar. Okay. Okay. So injury background. I have three things on here. So the injury onset. This onset, it's an acute injury. This means it's like a sharp pain that you feel. And the next thing, typical mechanism. How does this injury occur? The most common way it occurs is an acute stretch of the muscle. This can be often like a forceful mechanism, like as you can see in the picture right here, like jumping, running, landing, all different types of common ways to injure it. Okay, so one interesting fact would be all four parts of the quad do the exact same job. Every single one, the exact same thing. All right, next. So the injury identification, signs and symptoms. I have 5 right here. There's more, but I just did 5. The swelling, bruising, difficulty extending the knee or flexing the knee, reduced amount of physical motion, and sharp pain. Those are just the symptoms. Those are some of the symptoms. Okay. So for special tests, so starting the patient and the examiner position, the patient should be sitting with their knees over the side of the table, and they should be holding on with their hands onto the table. Make sure they have a good grip. And as far as the examiner position goes, make sure you're facing, as you can see in the photo, make sure you're facing the patient. So the examiner action, you want to hold your hand, one of your hands on the top of their leg, as you can see in the photo, and one right above their ankle, and you want to force the hand, the lower hand that's right above the ankle. You want to force that, and when they try to extend their knee, this puts pressure on their leg, and you can see it's easier to see if there's like a weakness or anything in the way. What indicates a positive test? Indicating a positive test, making sure there's full extension of the knee and no weakness or restraints. And what an injury positive test indicates, if this indicates if there's weakness or restriction when extending the knee when having a strain. Okay, and lastly, injury treatment. 3 ways to treat a leg, this injury. As you can see in the photo, this is elevation. This is important. Some people don't like to buy that, or like want to have to buy that. So you can, another common way is icing. This reduces swelling just like elevation, as well as you want to avoid all types of activity. And that's my